Imagine a country where giving birth is like one of the riskiest things a woman can do.
Yeah.
That's the reality in Pakistan.
Unfortunately.
Where many mothers and newborns tragically don't get to see tomorrow.
Right.
It demands our attention.
It does.
Not just because of the scale of this tragedy, but also because it reflects global health inequities.
Wow.
We can't ignore this.
Absolutely.
What's particularly heartbreaking is that many of these deaths
Preventable. Yeah, we're not talking about rare, untreatable conditions. We're talking about mothers dying from complications like severe bleeding after childbirth or dangerously high blood pressure. And newborns succumbing to infections that in many parts of the world are very easily treatable.
It's a stark reminder that where you're born can determine your chances of survival.
It's true.
It's not just about healthcare.
No.
It's about poverty, lack of education, and cultural norms that often prevent women from getting the care that they need. So where do we even begin?
Well, let's look back and see how we got here.
Okay.
Back in the 1990s, Pakistan's maternal mortality rate was over 300 deaths.
Wow.
Per 100,000 live births.
That's a lot.
That means that for every 100,000 babies born alive, over 300 mothers died.
It's a horrifying statistic.
It is.
So what was going on then?
Well, around the mid-90s,
Right.
the Lady Health Worker program was introduced.
Oh, crispy.
This program was designed to bring healthcare services to rural communities, especially for mothers and children.
So basically bringing healthcare to the women instead of always expecting them to, travel miles to reach a clinic.
Exactly. These lady health workers, they provided antenatal care, assisted with deliveries, and helped with basic family planning advice.
Okay.
And it really was a game changer in a lot of communities.
Okay.
And it did contribute to some improvements in maternal health. But sadly, those improvements weren't consistent across the entire country. And progress kind of stalled out around the late 2000s.
I guess it's not just about introducing programs.
Oh.
It's about sustained investment and making sure those programs reach every corner of the country.
You got it.
So what about today?
Yeah.
What's the situation now?
Maternal and neonatal mortality rates are still alarmingly high.
All right.
Even though there have been some reductions.
Oh.
Pakistan still ranks among the countries with the highest number of newborn deaths.
Wow.
Worldwide.
It's a complex picture, and I think it's really important to understand the regional differences within Pakistan.
Yeah.
For instance, Punjab, with its relatively better infrastructure, fares better than other provinces.
Generally.
But even within Punjab, there's a stark contrast between urban and rural areas.
Huge difference.
So it's not just about Pakistan versus other countries.
No.
It's about these disparities within the country itself.
Exactly.
We see a similar urban-rural divide in Sindh. Karachi, being a major city, has better access to healthcare than the vast rural areas of Sindh, which are often hit by floods and struggle with poor sanitation. And all these factors, coupled with delays in seeking care, put women at a much higher risk.
For sure.
It's like this double whammy of geographical and socioeconomic challenges.
Right.
What about the other provinces?
Well, Khyber Pakhtunkhwa faces its own unique set of challenges.
Okay.
The mountainous terrain and the areas impacted by conflict make access to healthcare a logistical nightmare.
Yeah.
It's especially difficult in those remote northern districts where a lack of proper referral systems can mean the difference between life and death for mothers experiencing complications like postpartum hemorrhage or eclampsia.
And then there's Balochistan,
Yeah.
which, from what I understand, faces the most severe challenges.
Yeah, Balochistan has the highest rates of maternal and neonatal mortality in Pakistan. It's sparsely populated, has very low literacy rates, especially for women, and its healthcare infrastructure is severely limited.
Oh, wow.
Many communities are incredibly isolated,
Yeah.
which makes it really difficult
Yeah.
for women to access the care they need.
Especially during emergencies.
Exactly.
And tragically, reliable data from Gilgit, Baltistan, and Azad Jammu in Kashmir is scarce. But we've seen small, localized studies that suggest that the situation is equally dire in those regions as well.
Unfortunately, yeah.
It paints a pretty grim picture, doesn't it?
It
It
does.
seems like this urban-rural divide is a recurring theme across Pakistan.
It is, urban centers with their concentration of healthcare professionals and facilities generally offer better access to skilled birth attendants and emergency care.
Makes sense.
Women in rural areas often have to rely on traditional birth attendants.
Yeah.
These individuals are valuable members of their communities, but they may not have the training to handle complicated deliveries or emergencies.
Right. Which unfortunately can have tragic consequences.
Poverty has to play a huge role in all of this, right?
It does.
Like limited access to resources and healthcare likely contributes to higher mortality rates and then, further perpetuates poverty.
Exactly.
It's a vicious cycle.
It is. Poverty is a major driver.
Yeah.
It restricts a woman's access to nutritious food, essential prenatal vitamins, and quality health care, including safe institutional deliveries.
And then there's the cultural aspect, too.
Yeah.
In many communities, women need permission from male family members to seek health care, which can cause delays.
Right, life-threatening delays.
Yeah, it's a very complex interplay of these socioeconomic factors.
It is.
Cultural norms and inadequate healthcare systems.
Absolutely.
So it's not just about building more hospitals.
Yeah.
It's about addressing these societal issues. But amidst all these challenges, is there hope? What can be done to break the cycle? Well, one of the most powerful tools we have is actually education, particularly women's literacy.
How does that tie into maternal health?
Well, when a woman is educated, she's more likely to understand the importance of prenatal care.
Okay.
Recognize danger signs during pregnancy and feel empowered to seek medical help when she needs it.
So education is almost like a preventative measure.
It is.
Giving women the knowledge and confidence to make healthy choices.
Exact.
The Pakistan Demographic and Health Survey found that women with even a secondary education were twice as likely to receive adequate antenatal care compared to those with no education.
Wow. Yeah, it's powerful.
Yeah.
That's powerful.
It makes you realize that investing in girls' education isn't just about social progress.
No.
It's a direct investment in the health and well-being of future generations.
Right.
But even with educated women, the reality is that Pakistan's healthcare infrastructure faces major hurdles.
It does. A lot of healthcare facilities, particularly in rural areas, are shockingly under-resourced.
Okay.
They lack basic equipment.
Like what?
Essential medicines.
Wow.
And even reliable electricity.
Oh my goodness.
Imagine giving birth in a facility without proper lighting or the necessary tools to handle complications.
Scary.
It's a terrifying reality for a lot of women.
Even if those resources were available, reaching a healthcare facility can be an ordeal in and of itself, right?
It can, absolutely.
The lack of proper roads, limited ambulance services, and the sheer distances to hospitals, especially for those in remote areas, can lead to devastating delays in receiving care.
It's true.
Particularly during emergencies.
Yes.
These delays can mean the difference between life and death for both the mother and the child.
Absolutely.
It's heartbreaking, isn't it?
It is.
It's like the odds are stacked against them from the start.
And sadly, the challenges don't end there.
Okay.
Pakistan faces a severe shortage of skilled healthcare professionals.
Oh, really?
Especially in rural areas. Okay.
This lack of trained doctors, nurses, and midwives puts immense strain on the existing healthcare system.
So we have a situation where women often lack the information.
Yes.
And the means to access quality care.
Yeah.
And even when they do manage to reach a facility, there's a good chance they won't have access to the specialized care that they need.
It's true.
It's a deeply concerning situation, and I think it's important for us to understand the specific causes of these deaths if we're going to find effective solutions.
Yeah.
So let's take a closer look at the main culprits behind maternal and neonatal mortality in Pakistan.
Okay.
What are the leading causes of death for mothers?
Well, the four biggest threats are postpartum hemorrhage, preeclampsia and eclampsia, sepsis, and obstructed labor.
Okay, so break those down for us.
Okay, so postpartum hemorrhage or excessive bleeding after childbirth is often due to mishandling of the third stage of labor, which is the critical period after the baby's born.
This is a stark reminder of the need for skilled birth attendants who know what they're doing and are trained to manage this very delicate stage.
It sounds like even seemingly straightforward births can turn dangerous really quickly.
They can.
Wow.
And then you have preeclampsia and eclampsia, which are essentially hypertensive disorders, meaning dangerously high blood pressure that develops during pregnancy. And if left unmanaged, these conditions can lead to seizures, organ damage, and even death.
So consistent monitoring during pregnancy is crucial.
Absolutely.
To catch these conditions early.
Yes.
Sepsis.
Sepsis is a life-threatening infection.
Okay.
It often stems from inadequate sterilization practices.
Okay.
And poor infection control during childbirth.
So basic hygiene is so important.
Absolutely, and proper medical protocols.
These are complications that, in many developed countries, are routinely prevented.
Yes.
And managed.
You're right.
It's heartbreaking to think that these women are losing their lives to such preventable causes. It's true.
And finally, there's obstructed labor.
Yes, obstructed labor is when the baby is unable to pass through the birth canal.
Okay.
And this requires immediate medical intervention, like a C-section.
Okay.
To prevent complications like a ruptured uterus.
Oh, wow.
Which can be fatal.
Oh, my.
And in rural areas, delays in reaching a hospital with surgical facilities can tragically turn a difficult birth into a deadly one.
It's a harsh reminder of the inequalities that exist within these healthcare systems.
For sure.
What about newborns?
For newborns,
the
biggest dangers are birth asphyxia.
Okay.
Infections, prematurity, and low birth weight.
Okay.
And congenital anomalies.
Okay, so let's start with birth asphyxia.
Okay, birth asphyxia is basically a lack of oxygen during birth.
Oh, okay.
And it often occurs because of delayed or improper resuscitation techniques.
So it's so important to have skilled birth attendants present.
Absolutely.
Who can intervene immediately if the baby is struggling to breathe. Infections like neonatal sepsis, pneumonia, and meningitis.
Okay.
Those are also major culprits.
And they often stem from
unsterilized instruments.
Okay.
Or poor postnatal care practices.
It seems like such preventable issues.
It is.
With the right knowledge and resources.
Absolutely.
Premature birth and low birth weight.
Those are often linked to closely spaced pregnancies.
Oh, okay.
Which can really take a toll on a mother's health and deplete her nutritional reserves.
Right.
And impact the baby's development.
And congenital anomalies.
Those are birth defects.
Okay.
Which are more common in regions with a lot of consanguineous marriages. Marriages between close relatives.
Right.
This can increase the risk of genetic disorders.
It's a complex interplay of factors, isn't it?
It is.
You know, social norms, economic hardship, and healthcare limitations.
It's all connected.
All contribute to this tragic situation. Well, but amidst all of this, is there any hope?
There is absolutely hope.
Okay.
We're not powerless.
Okay.
In the face of these challenges.
Yeah.
There are evidence-based solutions, strategies that have been proven effective in other parts of the world.
Okay.
That can be tailored to the Pakistani context.
That's great.
We just need the collective will and resources to put them into action.
Absolutely.
We can do this.
I agree.
We need to explore actionable solutions.
Yeah, it feels like we've been wading through some pretty heavy stuff.
It is heavy.
So what can actually be done to address these challenges and start saving lives?
It requires a multifaceted approach.
Okay.
We need to tackle this from all angles.
Okay.
Policy changes, healthcare system improvements, community empowerment, and innovative health education initiatives.
It's a lot.
It is. Think of it like a stool.
Okay.
It needs all of its legs to stand strong.
Okay. I like that analogy.
Good.
So let's start with the first leg.
Okay.
Policy changes.
Okay.
What kind of policy interventions could make a real impact?
First and foremost, Pakistan needs a strong national maternal and child health policy.
Yep.
And this should include a dedicated budget to ensure that words are backed by a real financial commitment.
Right, putting your money where your mouth is.
Exactly.
Okay.
We also need to enforce existing laws against child marriage.
Right.
Girls who are married young are far more likely to experience complications during pregnancy and childbirth.
It's such a tragic situation.
It is.
You know, robbed of their childhood.
Yeah.
Forced into motherhood before they're really physically or emotionally prepared for it.
Exactly. It's not just about healthcare.
Right.
It's about protecting the rights of girls and women.
Absolutely.
And access to family planning services is also essential.
Family planning, okay.
Empowering women to make informed choices about their reproductive health is absolutely crucial.
Yeah.
For improving maternal health outcomes.
So it's about giving women agency.
Yes.
Allowing them to decide when and if they want to have children. But policies are just words on paper unless they're effectively implemented, right?
They are.
So what about the second leg of the stool?
Okay.
strengthening the healthcare system itself?
We need a major overhaul in how healthcare is delivered, especially in rural areas. Basic health units and rural health centers, which are often the first point of contact for these pregnant women. They need to be upgraded.
In what way?
Imagine facilities with reliable water and electricity, essential medicines, and trained personnel who can manage normal deliveries and handle common complications.
It seems like such a basic thing.
It is.
Having properly equipped facilities.
You would think.
But it's often lacking.
It is.
Especially in underserved communities.
Absolutely. And the human resource shortage is huge. We need more skilled healthcare providers. And we need them in the right places. Expanding midwifery and nursing schools is essential, particularly in rural areas. But it's not just about quantity. It's about quality.
What do you mean by quality in this context?
Well, the training needs to be aligned with WHO recommendations. They need to equip midwives and nurses with the skills to manage complications, provide culturally sensitive care, and work effectively in resource-constrained settings.
Makes sense.
I mean, a midwife in a remote village in Balochistan faces very different challenges than a midwife in a well-equipped urban hospital. The training should reflect those realities.
So it's about tailoring the training to the specific needs of different communities.
Exactly.
Makes a lot of sense.
Good.
What about financial incentives? Can we encourage healthcare professionals to work in these underserved areas?
We can. Housing allowances, student loan forgiveness programs, or even salary bonuses for working in rural areas could be very powerful incentives.
It's about investing in the people who will be on the front lines of improving maternal health.
Exactly.
But what about the logistical challenges? Getting patients to the care they need can be a huge hurdle.
It can.
Especially in rural areas.
Especially in rural areas where transportation options are very limited. Improving referral systems is absolutely crucial. We need well-equipped ambulances, clear referral protocols, and communication systems to ensure smooth and timely transfers from local clinics to these higher level facilities.
Makes sense.
It's about creating a seamless network where women can access the level of care that they need without facing unnecessary delays.
It sounds like we're talking about a major logistical undertaking.
It is.
Connecting different levels of healthcare.
And
ensuring that transportation is no longer a barrier to accessing quality care.
It's essential. And we cannot forget about the power of data. Implementing a strong maternal and perinatal death surveillance and response system in every district is non-negotiable.
I'm not familiar with that system.
Okay.
Can you explain what it is and why it's so important?
Essentially, it means that every maternal death is investigated to understand the causes and identify areas for improvement.
Like a root cause analysis.
Kind of, Why did this woman die? Was it a delay in seeking care? Was it a lack of access to essential medicines? Was it a failure in the referral system? By analyzing these cases, we can identify trends. We can pinpoint weaknesses in the system, and we can make data-driven decisions to improve care.
So it sounds like a crucial step towards accountability and learning from past mistakes.
Absolutely.
To prevent future tragedies.
Exactly. And it's not just about collecting the data, it's about using it effectively. District level committees should meet regularly to discuss these challenges, share success stories, and adjust their strategies based on this data. It's about creating a culture of continuous learning and improvement within the healthcare system.
So we've covered policy, healthcare infrastructure, and data-driven decision-making. What about that third leg of the stool? Empowering communities.
Community engagement is essential. We need to involve religious leaders, tribal elders, respected figures within communities to advocate for maternal health. They can help dispel harmful myths. They can encourage healthy behaviors, and they can build trust in the healthcare system.
So it's about working with, not against, existing social structures.
Exactly.
And we also need to empower the women themselves.
Absolutely.
Women's support groups can provide a safe space to share information. Right.
They learn about essential topics.
Yeah.
Like nutrition and breastfeeding.
Yeah.
And support each other.
It's so important.
Through the challenges of motherhood.
Absolutely. These groups can be incredibly powerful.
It's about creating that sense of solidarity.
Yes.
And shared responsibility.
Right.
But often, knowledge alone isn't enough.
No.
Right?
It's not.
What about families who simply can't afford healthcare?
Yeah.
Or transportation to these clinics?
That's a problem.
Are there ways to provide more tangible support?
There are microfinance programs or conditional cash transfers.
Okay.
Can incentivize these healthy behaviors.
How about so?
Well, for instance, families could receive financial assistance for attending antenatal appointments.
Okay.
Or choosing facility-based deliveries.
Interesting.
It's a way of removing financial barriers.
Yeah.
And encouraging families to prioritize healthcare.
It's like a reward system for making healthy choices.
It is.
That's really interesting.
I think so. We've talked a lot about these traditional approaches.
We have.
But what about the role of technology and innovation?
Yeah.
Can tech play a role in improving maternal health?
It absolutely can. Think about the potential of mobile health programs.
Okay.
Pakistan has a very high mobile phone penetration rate.
Right. Even in rural areas.
Even in rural areas, we can use this to our advantage.
I've heard about these programs where women receive health information and reminders via text message.
Yeah.
Could that really make a difference?
It can. Imagine sending targeted health messages about danger signs during pregnancy.
Okay.
Newborn care tips,
right?
Or even reminders for antenatal appointments.
It's like having a virtual health worker.
Yeah.
In your pocket.
Exactly.
Providing vital information directly to the women.
Yes.
Even in these really remote areas.
Exactly. It's using technology to bridge the gap in access to information.
And where internet access is available.
Yes.
What about those interactive apps?
Oh, yeah. Think about the potential of those.
Yeah.
These apps could provide guidance on family planning, breastfeeding techniques,
right,
and they can even connect women with healthcare providers for virtual consultations.
So it's bringing healthcare to women's fingertips.
Exactly.
Making it more accessible, more convenient.
Yes.
And we can't forget about integrating literacy programs with these maternal healthcare initiatives.
No, we can't. You know, we've talked about the importance of women's literacy.
Yeah.
But imagine creating community centers where women can attend literacy classes and receive basic healthcare services.
At the same time.
At the same time.
So it's like a one-stop shop for women's empowerment.
It is.
Addressing both their educational and healthcare needs.
Exactly. Or imagine developing literacy curricula that incorporate reproductive health and childcare modules. By weaving these essential health topics into literacy programs, we can reach women where they are and empower them with the knowledge that they need to make informed decisions.
It's about being creative and finding ways to meet women's needs.
Yes.
Holistically.
It is.
So we've got a lot of potential solutions here.
You do.
Policy changes.
Yes.
Infrastructure upgrades.
Yeah.
Community engagement.
Yeah.
And innovative use of technology.
It's a lot.
But how do we translate all of these ideas into a concrete plan of action?
Well, that's where the implementation plan comes in.
Okay.
It's about moving from theory to practice.
Right.
Taking these broad strategies and tailoring them to the specific needs of different regions within Pakistan.
So getting down to the nitty-gritty detail.
Exactly.
Okay, let's get into the nitty-gritty.
All right.
Can you give us some concrete examples of how these solutions could be implemented in different regions of Pakistan?
Sure. Let's start with Punjab.
Okay.
Imagine a pilot program in a rural district, say Chakwal, that provides free transport vouchers for pregnant women to access healthcare facilities. This would remove a significant financial barrier for a lot of women and encourage them to seek timely care.
Makes sense.
And while we're at it, why not integrate maternal health lessons into the existing literacy classes for women?
It's a brilliant idea.
It is.
Killing two birds with one stone.
Exactly.
Women can improve their literacy skills while also gaining valuable knowledge about their health.
Exactly.
What about Sindh?
Sindh.
Its unique challenges related to flooding and sanitation.
Given Sindh's vulnerability to floods, we could prioritize refurbishing and equipping basic health units in flood-prone areas.
Makes sense.
With essential supplies and backup power systems. We should also train midwives and lady health workers in in waterborne disease prevention and management.
Right.
So they're equipped to handle the specific health challenges
Makes sense.
that arise in these regions.
So it's about being proactive.
It is.
And anticipating the unique needs of each region.
Absolutely.
What about Balochistan?
Balochistan.
Given its geographical isolation and limited infrastructure.
Balochistan requires a multi-pronged approach that leverages technology and empowers local communities. One promising solution could be establishing solar-powered telehealth hubs.
Interesting.
In remote communities connected to tertiary care facilities in Quetta.
Oh, wow.
This would allow for remote consultations, diagnoses, and potentially even emergency care through video conferencing.
It's like bringing specialist care to these remote areas.
Exactly.
Overcoming the barriers of distance and limited infrastructure.
You got it.
What a fantastic use of technology.
It is.
Are there other ways to address the shortage of skilled healthcare professionals in Balochistan?
There are. We could offer financial incentives and scholarships. Specifically for female students from underserved districts in Balochistan to enroll in midwifery and nursing schools. This would not only address the workforce shortage, but it would also empower women
within their own communities.
Exactly.
Investing in women to become healthcare providers for their own communities. That's a sustainable and empowering solution.
It is.
It's incredible how all of these solutions can be tailored to fit the specific needs of each region.
Yes.
But there's one common thread that runs through all of them.
What's that?
The importance of women's literacy.
Absolutely. We've talked about it throughout this whole conversation. But it's worth emphasizing again. Women's education is a fundamental pillar of improving maternal and newborn health.
Let's revisit that key point. We know that education is crucial.
It is.
But how does it actually translate into better health outcomes for mothers and babies?
Well, educated women are more likely to recognize danger signs during pregnancy. They're more likely to seek timely medical care, and they're more likely to practice good hygiene.
So education equips them with the knowledge to make healthy choices.
Exactly. And importantly, educated women often have greater autonomy within their households. They have a stronger voice, which means they're better able to advocate for their own health and the well-being of their children.
So it's about giving women the tools and the confidence to make decisions that impact their lives and the lives of their families.
Exactly. And that's why we need to advocate for policies that view girls' education not just as a social good, but as a critical investment in public health.
I like that.
It's an investment that pays dividends for generations to come.
It's about breaking the cycle of poverty. And poor health. And building a brighter future.
It is.
For Pakistan.
Absolutely.
It's been an incredibly insightful conversation. But I'm sure our listeners are wondering, what can we do? How can we, as individuals, contribute to this fight?
It's a great question.
For maternal and newborn health.
And it's the perfect segue into our final thoughts. You know, it can feel daunting. But even small actions can have a ripple effect. The first step is simply becoming more aware of these issues. Talk about them with your friends and family. Share what you've learned from this conversation. The more we raise awareness, the more likely we are to see real change.
So it starts with education, even here at home.
It does.
Spreading the word and getting people talking about these issues can really plant the seeds for change.
Absolutely. And if you're looking for more concrete actions, consider supporting organizations that are working directly on the ground in Pakistan and other countries with high maternal and neonatal mortality rates.
Are there any particular organizations you'd recommend our listeners look into?
Absolutely. The Aga Khan Foundation, for example, does incredible work in Pakistan. They focus on improving maternal and child health through various programs, from training healthcare providers to providing essential services in rural communities.
So listeners can do a little research and find organizations that resonate with them. There are so many ways to contribute, whether it's through donations, volunteering, or even just spreading the word about their work.
Absolutely. And don't underestimate the power of political advocacy.
Okay.
Reach out to your elected officials and let them know that global health issues, particularly maternal and newborn health, are important to you. Encourage them to prioritize funding for these initiatives.
It's about using our voices to demand change and hold our leaders accountable.
Exactly. And finally, be a conscious consumer. Support companies that demonstrate ethical and sustainable practices, especially those that empower women. You'd be surprised how many businesses contribute to improving the lives of women in their supply chains.
It's about aligning our actions with our values.
Yes.
And realizing that even seemingly small choices can make a difference in the grand scheme of things.
That's what it's all about, remember. The fight for maternal and newborn health is a global one.
It is.
While we focused on Pakistan today, these challenges and solutions resonate far beyond its borders.
Absolutely.
In working together, by sharing knowledge and resources, by raising our voices and demanding change, we can create a world where every mother and every baby has a chance to thrive.
It's a powerful reminder that even amidst these heartbreaking realities, there's hope.
There is.
There's always something we can do, no matter how small it may seem, to contribute to a better future for mothers and babies around the world.
Absolutely.
Thank you for joining us for this eye-opening discussion.
Thank you for having me.
And to our listeners, thank you for your willingness to engage with these challenging but crucial topics.
They are.
Together,
yes,
we can make a difference.
We can.